Good morning.
Good morning, Nadine. All right, so just want to go over our first case that we have here. We have Miss Collins in room 203, a 25-year-old female. She presented to the ED with complaining of chest pain and tooth pain. We noticed that her eyes are bloodshot, and she has what appears to be recent tracks from IV drug use on her arms. She's breathing rapidly and seems very uncomfortable. She has poor dentition and appears to have multiple cavities and broken teeth. She denies any medical history. So before we go into that, and we see that based on the MAR that she has a diagnosis of endocarditis. From your lectures, could you tell me what you have learned about endocarditis this week in your lectures?
Okay. Um, First, the pathophysiology of endocarditis would be the inflammation of the inner lining of the heart and or valves. This is where vegetation can form, which can become embryotic. Typically, this is caused by IV drug use or valve replacement. Causation of infective agent can enter via oral cavities, like during dental procedures, or from invasive procedures that result from general infection.
Okay, so I got a question. So someone that has heart valve replacement, why would that be um, a predisposition for endocarditis?
Because hard valves are not of they're foreign bodies, and it's not a live tissue, so that it provide an environment for infection to grow.
Okay, all right, good. So the outgoing shift, the most recent vitals for Miss Collins, her BP was 98 over 62. Her heart rate was 92 beats a minute and regular. Her respiration was 32. Her temperature was 37.9 degrees Celsius. O2 was 92% in room air. She complained of pain, a rate of pain of 4 out of 10, and states that it comes and goes. So, what would be your top three priority assessments?
Okay, I would still need to get my own full set of vitals. I would definitely focus on lung sounds and temperature. I know the previous shift at a 37.9 degrees Celsius, but the fact that she complains of toothache, and we have a diagnosis of endocarditis with which states there is some form of infection going on. We want to check temperature
Okay.
and listen to for any kind of abnormal lung sounds.
Okay. All right. And so, based on that assessment, what are the top three laboratory diagnostics tests that you would expect that the doctor would order?
Okay, in the report before, she complained of chest pain, so I'm gonna expect EKG, maybe chest X-rays, and since as the diagnosis is already endocarditis, I would expect CBC, CMP, and some blood cultures, and these should be done prior to the administration of any antibiotics.
Let's see. So, for Ms. Collins, what would be your top three nursing interventions that you would do for this patient?
Oh, definitely oral care. Um, I would say brush teeth at least twice a day with a soft bristle toothbrush, and applying stockings. What do you call those things?
Yeah,
Stockings,
embolic stockings.
and
And why a soft tissue toothbrush? Why not just any toothbrush?
because also expecting Miss Collins to be on some kind of anticoagulants, and for bleeding, you know, like we would like soft bristle toothbrush to prevent excess bleeding.
Okay. All right. And what medications would you expect this patient to receive?
Oh, like I said before, some kind of anti uh, coagulants. IV antibiotic and some analgesic, like something for pain.
Okay. All right. Yeah, because she was complaining of not two types of pain, the chest pain and the tooth pain. So
Correct.
we want to make sure that her pain is covered and that she's comfortable. Let's see. So what would you? What are some of the things that you would teach this patient?
I would teach this patient importance again, oral care, and teach to um, observe for any signs of or symptoms of infection like increased temperature, feeling just not feeling well, malaise, redness or swelling, how to apply TED stockings correctly,
Okay.
and to follow correct anticoagulant therapy.
Okay. And you also want to make sure that when you teach her the signs and symptoms of infections, that you make sure she gets those symptoms. To also teach her to notify her provider that, because this could be a reoccurring thing also. So what are some of the complications that, or the further complications that could happen from endocarditis?
This could lead to heart failure, embryonic stroke, and reoccurring infections.
Okay, so yeah, I think for instance, like the heart failure, that might be an issue while she was having the dyspnea and the low O2, 92% on room air. She could have been having complications already, even though endocarditis was the initial. She might have had heart failure along with that, or possibly have embolism in the lung. So hopefully it hasn't progressed that far, but we definitely get that O2 up. And that was good that you mentioned about the intervention with the O2. If we needed to get it higher, of course we would get a doctor's note, as that's also a medication too. But let's see, is there anything else? So what are some collaborative goals that we would offer for this patient? So that way when she leaves our care, that she's not back here a week later for the same thing.
Well, first I would say, based on the diagnosis of endocarditis, she would need to maybe be referred to a treatment program.
Okay.
And I would say a social worker needs to get involved to explain to Mrs. Collins or Miss Collins what's available for her, and let her know, like, for dental, like, how you say this, for dental
Dental
care,
Okay.
that she needs to notify her dentist and have prophylactic antibiotic prior to any kind of dental procedures. Also,
And you also may want to make sure from the aspect of the dental procedures that she doesn't have any procedures for at least 6 months with this diagnosis.
right, correct.
They're at risk for a worsening infection.
Right. So at the end of the day, what we want to get Miss Collins well. We want to treat the infections, which we're already doing with antibiotic. We want to teach her oral care. We want to make sure that she understands that help is available for her drug use, and get her as perfusing and promoting sufficient guest exchange as best we possibly can.
Okay. All right.
And that wraps it up.
All right. Great job, Nadine.